Good morning, Pam. How are you today?
I'm fine, thank you. Yourself?
Good. I just took a look at your chart, and it looks like you haven't had a diabetic foot risk assessment done in the past year. Is that correct?
Could be.
All right, well, let's do one today. That risk assessment is going to tell me whether or not you're at low, moderate, or high risk for developing some sort of a diabetic foot-related complication. And it will also help us to figure out what members of the healthcare team would be best suited to help prevent any ulcers or any other type of diabetic foot complication from occurring.
Okay.
So the risk assessment's really quick. I have a few questions to ask, and then I'm going to use this little piece of fishing line to check and see how much feeling you have in the bottom of your feet. So the questions are fairly simple. The first, have you ever had a history of peripheral vascular disease? And that's a condition where you don't have good blood flow into your feet. So you might notice symptoms like very pale skin in your toes, cold toes, toes that have tips that go black. Any history of that at all?
No.
Okay. And have you ever had a wound on your foot? No. Okay. And I don't see any amputations, which is perfect. And I'll take a look at your feet, but do you know if you have any foot deformities, like hammer toes, bunions, claw toes, dropped arch in your foot?
No, I don't think so.
Well, I'll take a look and confirm that as well. And any history of ingrown toenails?
Yes.
Yes, okay. And any current ingrown toenails?
No.
All right, well, I'm going to take a quick peek at your feet. So what I'm looking for when I'm looking at your feet is how warm they feel to touch, whether or not you have good pulses in your feet, any deformities in your nails or in the shape of your foot. All right, so when I'm looking at your feet, I'm just looking for areas of dry skin, areas where there's callus or blisters, or where there's signs that it's too wet. So a little bit of dry skin, but that's not unexpected. You do have. Just going to palpate for pedal pulses here. Very good. I'm just going to wiggle your toe, your great toe here, to see if you've got some good joint function. Very good. So other than a little bit of dry skin on your heels, no real fissures or cracked skin, no calluses, no real deformities in the feet other than some thin toenails and a history of ingrown toenails. So that's all positive. So now I'm going to check and see how much feeling you have in your feet. So I'm just going to put this on your hand so you have an idea of what you're feeling for. It's a very mild poking sensation. Okay, so I'm just going to check a couple spots in your feet to see if you can feel them. I need you to close your eyes and tell me what foot I'm poking and what spot on your foot I'm poking.
This foot, big toe.
Perfect.
This foot, big toe.
Great.
I think you're on the heel on this foot.
Yep.
The arch on this foot.
Great. So you've been able to find all 10 spots on both feet, which tells me that you have good protective sensation in your feet. That's great because your feet are going to tell you when they're in trouble. People with diabetes, as they age with diabetes, tend to lose some of the feeling in their feet, especially that protective sensation piece, which puts them at risk of traumatizing their foot or hurting their feet without knowing it. So stepping on a needle and not knowing you've stepped on it, or wearing shoes that are too tight or too loose that cause rubbing and can cause callus buildup and skin breakdown and not knowing it. So it's great that you have great sensation. Just going to clean my hands. Is there anything else I can get you before I leave?
No, I'm fine, thank you.
Wonderful. Great.